be live for about 15 minutes. You will also need to provide your name and the license types for your CEUs when you fill out the conference evaluation at the end of the conference. You must complete the conference evaluation for your CEU to be processed. You will receive your CEU certificates as soon as possible after the conference at the email address that you used to register. We do hope that everyone, regardless of CEUs.
Carol,
the conference evaluation link will be posted in the chat box in the last session each day and on our Pathways website for those who don't attend the entire day. So throughout the conference, please only use the Ask the Question box to post questions for speakers related to their presentations. Please use the chat box to engage with other participants for technical questions and to find the CEU sign in and sign out links. I will follow the Ask a Question box, combine like questions, and share with the presenters after the presentation. Personal information can be seen by all, so please consider this when posting in the chat or Ask a Question boxes. The CEU sign-in code for this session is 83. And now I'd like to introduce our speaker for this section. And the session is entitled Navigating the COVID-19 Crisis and Health Management. Our speaker is Mary Beth Fisk, who is a part of the conference steering committee, and she is also CEU of the Ecumenical Center for Counseling, Education, and Health. Mary Beth?
We'll go ahead and get started right away so that we can make our way through the content of the slides. And if you'd like a copy of the slides, just please contact us and we can review in greater length that information. The Ecumenical Center has been around San Antonio and South Texas, serving in the mental health and counseling areas, as well as education and health for over 50 years. The center itself has a variety of different counselings, and during COVID-19, like all of us, we had to find new ways of doing things that were definitely not what we were used to. So this is just a very quick and kind of high-level timeline of what happened with COVID responses. In March, of course, everything began to shut down and close. And I'll just kind of walk through a few of these and I'll move on because we've got some details for each a little later in the presentation. We began with telehealth and telephone counseling very early in our mid-March timeframe. Fortunately, we already had technology, but we did have to add technology, add additional machines along with everybody else in the community. So there was a shortage, and fortunately, we're able to get those up and going. We reached out very deliberately to seniors, to caregivers, families, and children during this time with wellness conversations. We'll talk about those in a short little bit. In May, created vignettes, which are short little videos, where we had an art therapist talking about some ways in which you can use art in the healing journey, and especially these were developed around anxiety and depression because it was so prevalent and has been so prevalent in our communities. So I'll go ahead and move on because I believe we're going to talk about each one of those as we go through the presentation. So First and foremost, wellness conversations. What is that? Wellness conversations we developed years ago with clergy where they could call a counselor and visit for 20 to 30 minutes on the telephone. It's not a cost. Or they could do telecounseling sessions. That was also very readily available. All of these were done in a trauma-informed way. And the six principles, of course, in trauma-informed approaches is safety and trustworthiness, collaboration, empowerment, choice, and really, very importantly, we can't underscore more the need to make sure it's culturally relevant. Each community has its culture, and there are people within the communities that have differing cultures, and we need to be sensitive to that each time. This is a video that ran on Facebook accounts. It was one that was developed for really our entire community, but it just really reminds us that in the comfort of your own home, you can have a conversation, a wellness conversation, and it was shared in that way. Communication was most definitely a very important part of the whole process. And so some people, of course, are on Facebook. They have access to Twitter, they have access to their televisions and other means of getting information, while others do not. So one of the things, particularly for our seniors, we noted is technology may not be readily available in their home, and they were not able to leave their home. So we did convene a partnership with Meals on Wheels with many of the different senior centers in and around our area. And we sent this little card out. And this card says, meet with a counselor in the comfort of your own home. We can have a conversation by telephone. There's no out of pocket expense. And this is just an opportunity to see how you're doing and to talk to another person. And so just wellness things were encouraged on that. The conversations themselves also extended to students and families and to our educators. But one of the key things, especially again with no technology in the homes, which we do have some families that with no technology or no signal to receive for the technology, we distributed the notices through the school meal lunch program because they were making contact with those families, and they just included that as they made their deliveries. And again, they were free of charge. So a card, something like this, would say, dear friends, it's important to be connected with others during the time of COVID-19. There's free conversations, telecounseling, phone sessions, and they've been proven to be effective. It's important to let people know, of course, that there's not a cost to this during this time. And here's the telephone number to call. And so that was distributed widely. We also, through this process, teamed up with community centers, other organizations that had extended reach, and businesses. And still today, we're working with many businesses who are looking at the self-care perspective for their staff members. So on site, we did not close our doors because of being an essential service, it was important, but we did make some very significant strides in the health screening of every individual, employee and client that came to the center. We did ask, of course, like our hospitals did, that we only have the client come in just to reduce the risk for everyone involved. We put up plexiglass screens, just like we saw many of our retailers do, even between the sinks in the restroom, to make sure that we were acting as safe as possible. Temperature checks on everyone, health questions, if you've been around anyone with COVID or have you yourself been tested positive, and that, like I said, included everybody. We also beefed up our cleaning, and that's an important thing not to miss and to bring up in this conversation is that we did order UVC lights enough in quantity so that we could run those every day in each of the areas of the centers, and not just the area of the center here in San Antonio, but our other offices that were operating as well. So looking across the map, the Ecumenical Center does have 25 locations around South Texas. One of the strategic decisions made during the beginning of COVID was to consolidate And once COVID has come and passed, then we will open these other locations up. But it became important to look at regional ways to reach people. And if we needed to provide a bus pass or some other way of transportation for people to get to a particular location, that was something we could do as well. So the headquarters, which is located in the medical center area, of course, has been open and continues to be open. Our offices in the Wilson County area, two out of the three are opened at present, and that's the primary Center for Hope and Healing, and then at the First Baptist Church of Sutherland Springs, where we're working with families who came through that tragedy. Laredo, McAllen offices open. Our Hill Country office and an integrated behavioral health care and our Corpus Christi offices have maintained their opening, and then we'll open the other locations up as COVID reduces and the risks reduce. A very important program that we'd like to share with you today is the work that we've been doing for healthcare workers in hospitals. They basically are working, and we know that there are heroes because they have committed to working long hours, and many of them don't have time with their families, or they have basically moved into a different housing because they're going to come home, go to sleep, and go back to work in order not to bring risks to their families at home. And that does create a great deal of stress. So we put together a program and approached one of our local hospitals here and offered debriefing sessions. We call it Coffee and Conversation. It's a non-threatening title, and yes, there's coffee and there's donuts, tacos sometimes, and we provide just some conversation, dialogue, and counseling for our medical and nursing staff. It's all done by licensed counselors in that setting. So this is one of the flyers that we put out for that program. While your healthcare professionals are caring for patients, who is caring for them? And so we've been working with sharing with them relaxation techniques, coping, burnout, fatigue, de-stressing, breathing exercises, kind of cultivating joy, and still trying to remain thankful and truly trying to remain resilient through this process. Another tool that was given to them, and many tools have been provided over the last 4 months that we've been providing this service, and that is journal writing. So we've provided them with a journal along with guided writing exercises that they can take home and do. We actually have distributed, since this slide was done, over 150 of these self-care and wellness journals, and we just continue to have a call for more. So additional outreach, the debriefings we've mentioned, kind of therapy on the go, going to them is a big, important piece. The music and wellness has been offered 3 days a week for the nursing units, and that's at a time that they're least busy. Excuse me. We've also had instrumental music played on 3 floors. We've had a harpist, a classical guitarist, a cellist, and they are all garbed up in appropriate PPE, and they play to relax. They play music that's slow and relaxing for the staff there on the unit, as well as the patients. They can hear it as well. And of course, individual counseling. This is the slide or the notice that we put up in the hospital that really talks about why are we doing this? Why is music therapy? Why is the playing of music relaxing? And how can it help you get through a difficult time like we've had with the pandemic? So we know that musical interventions can reduce stress, anxiety, fatigue, and burnout. And there's so much more, as you can see on the list on the slide as well. So here you have a few comments. I'll give you just a moment to look over those. A few comments from the staff, the nursing staff. And we've done, so that's what we've done within the hospital and healthcare service to date. The school outreach has also been an important component with most recently the reopening of schools and deciding how the format was going to be. So wellness conversations have been offered to the educators, to the parents and the students as well. And we'll continue this whatever length of time is needed. So here we go. Yet one more way it's laid out. And we try to tailor it to the audience for which we're working with. This is another of the Facebook programs that you'll see. You won't hear the sound on this, but it's tailored for our military and veteran community. We've been working with 5th Army North on Family Readiness Command Battalion chaplains, working with them, along with the 63rd Army Reserve Nurse Care Manager, really working weekly to develop coping methods and articles and materials that we can share with them, that they can share in turn with their soldiers. Another important program was the Refejo Court. We've worked with Judge Spiegel Gonzalez. So we do staffing and we're working with counseling. I apologize. We know that there's been hyperarousal during COVID. And given that, what we also know is that people have been cooped up at home, and we've seen a marked increase in domestic violence in our community. So this program, it's a special court program that has been funded separately, is dealing with first offender domestic violence, providing them a rehab. There are many parts to this. The Ecumenical Center plays one part of many. And we do counseling and we do work with the staffing so that we can help give feedback back. That, of course, the person that was the offender has followed through with the services that have been provided. An important thing for us, I think, at the Ecumenical Center was almost a very self-soothing thing for us, was to write a little bit about the questions we were hearing from the community. So we put together a series of articles and a series of tip sheets and so forth on the questions and prepared to answer those. So I'll run through the table of contents of what those questions were. So, what is anxiety and what is depression? How am I feeling? I miss my friends. I'm afraid to get sick. How do I protect my loved ones? I'm so lonely. Do any of these resonate with each of you? They certainly do with us. Trusting again. How do I trust people again? Because sometimes during this pandemic, people let us down. And then where do I find my joy again? How do I get help? How do I trust God again? In some cases, that was a question people were asking. The wellness tips, as you see them listed here, down here, under the left-hand column, really were developed for parents and kids and senior centers and caregivers. And it included relaxation tips and healthy relationships and forgiveness and self-care strategies. So the education offerings during COVID-19 created the tip sheets. So let's take just a quick peek at these. If you're interested in getting a copy, just contact us, please. So this particular sheet was tips for parents and kids. This was tips for adults. This was created for caregivers and for especially our seniors. What could they do as they were cooped up at home and couldn't be around family? And as you can see, there were several very simple things suggested, but write a note to somebody to tell them how much they mean to you. That can make them feel good and you feel good at the same time. It certainly feels good to receive those. So caregiver tips, during this time, we certainly take a pause to remember those who have lost their lives to COVID and the families of those who have passed away during this time. Thank you. As a caregiver, we start, each work day with mindful meditation. That's a great way to begin. Drink plenty of water, breathe, do deep breathing, check in, listen to calming music. Some of these things sound like, oh, yes, we all know how to do that, but sometimes we need to be reminded. So these tip sheets were widely used. Unfortunately, our video, I don't believe is going to run. We'll try this.
Hi, Mary Beth. Heads up, this is your Nowcast technician. The audience is not going to be able to hear the audio from this video.
Thank you. Okay, sorry about that little glitch, but unfortunately the audio is not going to come across. So we'll move on, but just to note that this is the address. There will be in the slides that if you're interested in reaching out and looking over these videos, there's one on music therapy, play therapy, forgiveness, art therapy, and other children's concern, as well as healthy relationships. Another way in which we got the word out about the wellness conversations and not just sitting there and being depressed was to reach out to the media and let them know that there was resources available, as many other organizations did as well. So we're grateful for them, to the media, for running that information. Also to our print media, April 23rd, 2020 is an article that really did talk about, the loneliness and how anxiety and depression are such a key piece that we do need to be very cautious of. And they let folks know also in this article about the wellness conversations and the other tip sheets and things that were available to folks. We did go through a holiday, maybe many holidays for your families during this time of being shut down. We were not able to be together at Easter. So that was a challenge for many families who had a very long-standing tradition of celebrating that time together. Parks were closed, and that was to keep us safe. But there was really important things to share with folks during that time. And as we go into the latter part of this year, depending upon how COVID and the pandemic continue to run, these things may also be very important to us at that time. The videos that we share, let me just give you another couple of examples. Deb Murphy, a registered art therapist, did a video on how to use art to enrich you and your children's time. So it's focused on kiddos. Beth Stanley, who's a licensed professional counselor, also tips on dealing with your feelings, couples relationships, how to use music to help support relaxation, and how to breathe. And then this was reflective of one of the videos that Dr. Frank Emmett, our clinical director and retired colonel from the Air Force, he did a video that focused on the anger and depression and, some of the feelings and some of what people were dealing with at the time, and just sort of gave some suggestions of how to ease that, what you can do about that. This presentation would not be complete without saying that you need to focus on self-care. That's for everybody on the call. Everybody is a part of the workshop, our entire community. For us, we said self-care for staff, of course. What could we do? What could be provided? And we're still working on this. This is work in progress, and you continue to see what's most effective. But certainly, we've offered meditation and centering prayer weekly here at the center. We do a check-in almost daily, but at a minimum weekly, and just check on the wellness of the individual, and then being sensitive to differing needs and shifting needs of the staff during the pandemic. They may have children at home. They may have someone who's ill, suffering from COVID, And so being very mindful of that. Yoga, meditation, all are very good ways of offering support. During the time of COVID, one of the programs that has come to the Ecumenical Center, and we know that it's going to do great work in our community with all of the participation that there has already been and will continue to grow. But the youth behavioral backbone basically has established youth behavioral needs and provides focused strategies to decrease youth suicide rates, which has markedly increased. Unfortunately, we've seen that increase during COVID-19 in both youth and adults. So there's more to come on the backbone, and probably many of you that are on the call now will be a part of that in a community of Bexar County. We're going to look to tap in and try to get upstream with services, so we're not at the crisis point, and that's the really important point behind the youth behavioral backbone. Another component that was provided during this time was camp wellness, and we've done the camp for many years, though never virtually. So this was another way to adapt to what we could do. The camp was held for 5 days for ages 5 to 11. And we had 65 campers. We did limit it to 65 campers just because we weren't sure how this was going to roll out. They were given a backpack filled with all the materials they would need for the activities over those 5 days. Started at 1 o'clock in the afternoon, went for about 2 hours, 2.5 hours, depending upon the activities. But it was a very engaging opportunity for these kids. Many of the exercises, and I'll just give you an example of a couple. Everyone was given a gratitude box, a decorated box, and they were given these little short pieces of paper. They were asked that throughout the camp and continuing beyond that is to write a little note on those pieces of paper saying what they're grateful for, and then put them in the box. So on a day when they're feeling blue, they can go pick that box back up and read, what am I grateful for, and kind of recenter themselves. Anti-bullying, writing letters to our seniors and senior centers was another activity that was part of it. Watching nature and seeing nature grow, and then music, of course, and so forth, and art were a big part of camp. Here's a list of those activities. I've mentioned most of them, but in total, we had 360 camper sessions. Here's a couple of images from the 2019 camp where you can see we're all together. And then 2020, where we're in a totally different environment and masked up as they pick up their bags. So kind of quantitative accomplishments, the number of wellness conversations for adults, seniors, families, and educators since the start in March, we've had 1,850. We've had a 95% satisfaction rate during COVID on our assessment, our satisfaction assessment. We're pursuing our trauma-informed certification for the organization, as well as working as the certifying body for Bexar County and San Antonio. The center has a number of wellness tips that have been distributed. They are now upwards of 2,000 pieces distributed, and then many more electronically shared. We've had, again, more of our instrumental music sessions on the nursing units, the wellness conversations within the hospital component, the music therapy sessions, and we've really gotten great feedback for that. Lessons learned, and we always want to sit back and say lessons learned, yet we're not done, is really kind of that difficulty of selecting the ideal virtual platform for wellness conversations. We had to just make it very varied to make sure no one was left out. Also, the need to offer both telecounseling with visual component or phone only, and our seniors may lack that technology. And we need to have outcome surveys no matter what where we are in the process, because that's going to help us make things better, getting the feedback from our clients. So again, telecounseling, we know it has a future. We know that it may not be the preferred method. If being face to face, you learn so much more, but there will be a place and a time, even past COVID, the telecounseling will be available to help someone who might not otherwise be able to receive that help. You know, everyone suffers mentally during a pandemic. It's a trauma. The symptoms are often magnified, and there's just that general increase of anxiety and depression. And working from home culture can work very well for some, but others find it most difficult to stop. So their boundaries and find themselves working all the time. And then others are fearful to go back because of threat of contracting the virus. So what's the sustainability plan for the wellness conversations? It's truly a priority. There will be opportunities to raise funds, of course, and look for grants that may help to support it. At this point, it was important for us to launch when we did and not to wait for that to come through. Lastly, the virtual wellness programs that we've talked about, the hospital outreach, the family outreach, the schools, our educators, and also our nursing homes and senior centers who haven't been able to meet with everybody yet. But this last little video that's running with no sound, you'll see is we got one additional Facebook piece that was put out just to remind people that don't give up. Don't give up. There is hope. And if you need to reach out and talk to someone, you can do so using wellness conversations at this point. So with that, I'll pause and invite any questions.
All right. Thank you very much for such a great presentation, Mary Beth. Now, everyone, please take note of the sign out code. It's 51. And now we're ready for questions. Mary Beth, one question is whether or not they're going to be able to get copies of the tip sheets.
Absolutely. They're embedded in the presentation, but if they'd like the full copy, they can contact me at the address that's in the slides, and I can give you my email address as well, and that's mbfisk@ecrh.org.
Okay, so you've already answered the next question. It's whether or not they can have the slides.
Sure. We're happy to share.
Okay.
The center, we did receive notice from the National Council on Behavioral Health, and we're one of 10 organizations that were recognized for some of the work that was launched very early in COVID and continues today. And so we really want to be able to help share that information. And we love hearing from others as to how they handled things and what creativity they were able to plug in to reach more people.
All right, next question. Are the journals geared for other staff, such as AOD counselor?
Absolutely. Now, the journals right now are really focused on healthcare workers because of the nature of the fact that they had to be there. They could not take off. They could not quarantine unless they had been exposed to the virus or had the virus themselves. And so there's a few wording changes in there that we have begun to tweak so that would be applicable to our educator population and so forth. But we do have those booklets both in English and Spanish.
Okay. Thank you, Mary Beth. And where can someone find information for the hospital outreach wellness conversations?
Sure. Again, just contact me, if you will, at the Ecumenical Center. The telephone number here, if you prefer to call, is 210-616-0885. That's probably the best way. It's a program that has been going for a while. We're learning. as we go, and we're continuing to insert creativity to that while being safe at the same time. So we do have several other hospitals in our communities that have contacted us, and we're currently working through the details of being able to provide some of those services there.
Okay. I think that covers, let me double check one last time to make sure I didn't miss any questions. Just a reminder that the CEU link was going to be up for only 15 minutes. And that last sign out code, I'm sorry, was 51. Is 51. Okay. I think that's it, Mary Beth.
Wonderful.
How wonderful. What a great presentation.
Thank you so much, and our best to all, and make sure you're taking care of yourself during this time.
Thank you.
Bye-bye.
All right. This is our your Nowcast SA tech. Mary Beth is disconnected in this session. The session content is officially closed. We're going to keep it live for just a while. However, if you are planning to take a break or do something else, you can feel free to do so. Carol, do you have any other comments or anything you need to add?
No, are we still live?
Yes, we're currently still live. The session sponsor slides will go up in a moment.
Okay. No, I don't have anything else. It's just wonderful. Her information was awesome. Thanks to everyone for being here today.
Absolutely. I believe our chat will continue to be moderated for a while. So if you do have questions or there's something that you need to ask, please feel free to use the chat, and that will be continue to be monitored for another few minutes. Thank you very much. You'll hear silence on this session going forward. So if you have any questions, use the chat box. Thank you.